The shoulders. The shoulder is particularly prone to injury during weight training due to both its structure and the forces to which it is subjugated during lifting. Like the hip, the shoulder is capable of rotating in any direction. The hip is a stable ball and socket joint, but the glenoid cavity of the shoulder, which holds the head of the humerus, is not a true socket and is significantly less stable. The shoulder joint has the greatest range of motion of all the joints of the human body. It is so mobile that the head of the humerus can actually move 1 inch out of the glenoid cavity during normal movement. But the joint's excessive mobility contributes to its vulnerability, as does the proximity of the bones and muscles, tendons, ligaments, and bursa of the shoulder. A small degree of swelling in the muscle due to an injury, however minor, can bring about friction with adjacent structures that can worsen the original injury and cause damage to previously uninjured tissue. The stability of the shoulder largely depends on the glenoid labrum, a joint synovium, and capsules, ligaments, muscles, tendons, and bursa. The rotator cuff muscles, supraspinatus, infraspinatus, subscapularis, and teres minors, and pectoralis are particularly instrumental in keeping the ball of the humerus in place. With the shoulder great range of motion, its various structures easily impinge on one another, causing tendinitis as well as inflammation and degradation of contiguous tissue. High forces during lifting can result in tearing of ligaments, muscles, and tendons. Particular care must be taken when performing the various forms of bench, incline, and shoulder press because of the great stresses they place on the shoulder. For these exercises, it is particularly important to warm up with relatively light weights and follow a program of exercises the shoulder in a balanced way. Using all of its major movements, see the following sections in movement-oriented exercise prescription, it is best to exercise at the controlled speed rather than to lower the weight rapidly and decelerate it sharply in the transition from the eccentric to the concentric phase of each repetition. The knees. The knee is prone to injury because it is the location between two long levers, the upper and lower leg. Flexion and extension about the knee occur almost exclusively in the sagittal plane. Rotation of the frontal plane and transverse plane is prevented mainly by the ligaments and cartilaginous stabilizing structures. Yet it does not take a great amount of torque about the knee in the frontal plane to cause serious damage. Frontal plane torque on the knee occurs, for example, when a football player is hit at mid-leg from the side while their foot is planted firmly on the ground. Fortunately, in lifting, torques occur almost exclusively within the knee, normal plane of rotation. Of the various components of the knee, the patella and the surrounding tissue are the most susceptible to the kinds of forces encountered in resistance training. The patella's main function is to hold the quadriceps tendon away from the knee axis, thereby increasing the moment arm of the quadriceps group and its mechanical advantage. The high forces encountered by patella tendon during lifting can lead to the tendinitis, which is characterized by tenderness and swelling. Knee wraps. It is not unusual for lifters to use knee wraps during training or competition. The wraps vary from the thin, elastic pull-on variety that can be purchased in drugstores to the heavy, specialized wraps that sold only through weightlifting supply houses. The use of knee wraps, particularly the heavy ones, is most prevalent among power lifters. Very little research has been done on the efficacy of knee wraps. A number of professionals working with lifters have noted some detrimental side effects from heavy wraps. However, including skin damage and chondromalacia patellae, the wearing down and roughening of the posterior surface of the patella. Though there is no available evidence that wraps protect the knee against injury, an experiment conducted by Harmon and Frickman showed that wraps can improve lifting performance through a spring effect alone. Heavy wraps around the knee add an average of 25 pounds to squat lifting force. The notion that wraps work only by either stabilizing the knee, lessening the lifter's fear of injury, or providing a kinesthetic cue is incorrect. The wraps actually provide direct help in extending the knee. Based on the lack of evidence, the knee wraps prevent injury, and the opinion of the number of health practitioners who work with lifters that they can actually cause injury. Lifters should probably minimize the use of wraps. General safety tips. The following activities and procedures have been recommended to reduce the likelihood of injury during weight training. Perform one or more warm-up sets with relatively light weights, particularly for exercises that involve extensive use of the shoulder or knee. This stimulates blood flow to the muscles, affecting the movement, increasing the temperature and pliability of ligaments, tendons, and other structures. Massage may provide additional benefit. Perform basic exercises through a full range of motion. Perform only specialized supplementary exercises through limited range of motion. Use relatively light weights when introducing new exercises or lifting after a layoff of 2 or more weeks. Do not ignore pain in or around the joints. Working through pain can lead to chronic injury. Often an athlete can continue lifting by using lighter weights with more repetitions using different exercises or both. If pain is severe and persistent, it may be necessary to temporarily suspend all lifting that affects the painful joint and to have injury examined and treated medically. It is usually not necessary to discontinue resistance exercises completely. Never attempt maximal lifts without proper preparation, which includes technique instruction and a minimum of several weeks of training in the exercise movement. It is also prudent to phase in periods of maximal lifting a few times a year at most. Post-workout icing of superficial joints under heavy stress may aid in prevention of injury as well as recuperation. The inclusion of supplementary exercises in a workout may help to promote joint stability and balance among the muscles of a group and between those of opposing groups. For example, heavy squats can be accompanied by knee extension and flexion exercises on a weight stack machine. Lack of balance between muscles have been cited as a cause of athletic injury. It has been recommended that athletes perform exercise routines that maintain a ratio of knee flexion torque to extension torque of 0.67 to 0.77 at slow speeds. Avoid bouncing at the bottom of the squat exercise. The high eccentric forces produced during such movements is a primary cause of muscle injury. Take care when incorporating plyometrics into training programs. It is generally agreed that athletes should be strong in the squat before beginning a lower body plyometric program. Also, high-intensity plyometrics should not be performed year-round. During squatting, deviation of the knee from a vertical plane through the foot and hip can place potentially dangerous and unnecessary torques about the knee and should be avoided. Use knee and elbow wraps with great caution. If used at all, they should be limited to the heaviest lifts. Heavy and tight wraps can cause joint injury. If used, put them on immediately before and remove them immediately after each lift. Performing several variations of an exercise, a series of combinations on the flat bench press, incline bench press, and decline bench press to train the chest and shoulders, results in a more complete muscle development and joint stability. Do not attempt explosive exercise such as cleans, jerks, snatches without qualified instruction before minor flaws in technique can place extremely high and potentially destructive forces on muscle, ligaments, and tendons. Emphasize correct technique and mental concentration. Movement analysis and exercise prescription. The concept of specificity, widely recognized in the field of resistance training, holds that training is most effective when resistance exercises are similar to the sport activity in which improvement is sought, the target activity. Although all athletes should use well-rounded whole-body exercise routines, supplementary exercise specific to the sport can provide a training advantage and reduce the likelihood of injury. The simplest and most straightforward way to implement the principle of specificity is to select exercises similar to the target activity with regard to the joints about which movements occur and the direction of movement. In addition, joint ranges of motion in training exercises should be the least as great as those of the target activity. Biomechanical analysis of human movement can be used to quantitatively analyze the target activity. In the absence of the requisite equipment and expertise, however, simple visual observation is adequate for identifying the basic features of a sport movement. Exercises can be selected that involve similar movement around the same joints. Slow motion film or videotape can facilitate the observation. A simple list of possible body movements that provide a manageable framework for a movement-oriented exercise prescription is illustrated across. 3.21. Only movements in the frontal, sagittal, and transverse planes are considered because although few movements occur only in those three major planes, there is enough overlap of training effects that exercising muscles within the planes also strengthens them for movements between the planes. Movement-oriented exercise prescription. Although a program providing resistance exercise for all movements in Figure 3.21 would be both comprehensive and balanced, some of the movements are commonly omitted from the standard exercise programs, whereas others receive particular emphasis. Important sport movements not usually exercised in standard resistance training programs include shoulder, internal and external rotations, knee flexion, sprinting, hip flexion, kicking and sprinting, ankle dorsiflexion, running, hip internal and external rotation, pivoting, hip adduction and abduction, lateral movement, torso rotation, throwing, and all the neck movements, impact absorption. A resistance training program designed around sport-specific exercise movements, however, is important for both improving performance and reducing the likelihood of injury. Figure 3.21 can assist in designing comprehensive and balanced training programs, determining deficiencies in existing programs, and identifying exercises that could improve performance in particular sports. Visual observation of a sport with or without the assistance of high-speed film or video allows the movements that are particularly important to the sport to be determined. Specific training exercises can be selected that provide a resistance to relevant movements through the appropriate ranges of motion. Not only should the desired movements occur in an exercise, but the movement must be resisted. An arm curl involves both flexion and extension of the elbow, but only the flexion is resisted. Specifically, of speed is important to consider as well. If a sport involves rapid application of force, then explosive exercises should be incorporated into the training program. As an example, the using of Figure 3.21 to qualitatively analyze a sport activity, we can look at the tennis serve. The following movements in the sagittal plane are key components of the tennis serve. Lower back, hip flexion, while knees are straight, shoulder extension, elbow extension, and wrist flexion. Thus, basic exercises can include leg raises, pullovers, tricep pushdowns, and wrist curls. More specifically, exercises include throwing a 4 to 6 pounds ball forward and downward and executing the serving motion with a weighted racket. Conclusion. It is hoped that readers will apply the biomechanical principles provided in this chapter to the selection of resistance exercise equipment and the design of exercise programs. Knowledge of how different forms of resistance tax the body can aid in the tailoring of programs to suit the specific needs of various types of athletes and others who engage in resistance training for enhancement of physical performance, health, well-being, and self-confidence.